let's begin at the beginning with diagnosis. Dr. Carr, could you walk us through the process of diagnosing a child with NF? What signs should families look for?
Yeah, so I think diagnosing a child with NF1, although as a clinician it may sound easy, but it's still a process for a family to understand what their child is getting diagnosed with. You could, most patients that I see in clinic, they're usually referred to me by a pediatrician who would notice the signs and symptoms of neurofibromatosis type 1. And the most common sign that they would notice on exam is birthmark called cafe au lait spot. When a child is born, they may not have as many cafe au lait spots that are needed for diagnosis, but as you grow older, those spots can increase in size and number. Hence, the follow-up is important. So the most common way a child is diagnosed with neurofibromatosis type 1 is based on the size and the number of these birthmarks. If they have more than 6 birthmarks that are larger than, 0.5 centimeter in a prepubertal child and more than 1.5 centimeter in a child who has attained puberty, that's one of the most, common criteria. And in addition to that, you need a second criteria, which could be there are various criteria for NF1. And that's where we need to, educate pediatricians and also parents to look for those signs. But honestly, it's our responsibility as pediatricians, a pediatric neurologist, to diagnose these patients. Other signs to look for would be optic pathway glioma, and that's why we need ophthalmologists, right? Our eyes are sort of window to our brain, and especially in a neurocutaneous condition like neurofibromatosis type 1. After seeing me, the second stop would be seeing Dr. Zager, where she would look into a child's eye and screen for optic pathway glioma and other signs that we can see with neurofibromatosis type 1. And, then you'll meet with someone like Taemin O, Dr. O, and the reason being up to 50% patients with NF1 can have skeletal manifestations like scoliosis. And although that's not a major diagnostic criteria, there are other bone deformities that could be seen, such as long bone dysplasia, tibial dysplasia. That's one of the criteria. And then, family history. 50% of these patients will have, one of the parents with NF1. So the families where neurofibromatosis type 1 is already a well-known condition, that's where they probably would go to pediatrician if they notice their child has birthmark and raise a question about NF1. And, then there are other criteria, and most recently, genetic testing or a pathogenic variant on genetic testing was included as one of the diagnostic criteria. So the exam is just examining the whole child, includes a skin exam, eye exam, ensuring that we screen, blood pressure and look at the back for scoliosis. So the journey starts the day the patient gets referred and a question is raised about neurofibromatosis type 1, but that's not where it ends. It starts with the diagnosis, and then it's about building the bond and relationship and following these patients across the lifespan in a way to screen for complications that you expect since it's a tumor predisposition syndrome, and screen so that we can get ahead in the game and we diagnose patients and screen for conditions that are possibly treatable, if not curable. And that's where my role is, but it's a teamwork. It takes a team, and that's the reason you're meeting with my colleagues, and we work together. And so you need a neurologist, you need an ophthalmologist, you need a neurosurgeon who has special interest and expertise in scoliosis. So it takes a village to care for a child with NF1.
Thank you. Joseph, what was your experience like when your child was diagnosed?
Yeah, I mean, the first signs we looked at it is that when he was age 1 or age 2, we saw developmental delays. There was delays in his speech and some of his motor skills and things like that. that, and we have seen, like Dr. Kaur mentioned, these coffee colored spots on his skin. That But I can say, teachers in school, when my son was in pre-K 3, they really identified that he is having into that ADHD spectrum. Looked at, there is a need for evaluation. So they recommended us, from a school, to have a neuro, developmental, evaluation, and that doctor enabled us to look at genetic testing, looking at these, because I say that genetic testing actually enabled us to look at, or, kind of, confirm that there are specific mutations in his NF gene, and that kind of enable us to get more care for him at early stages of his life. I think that's more critical, to have these genetic testings available to patients in questions, or and available to parents to have their child to get better care at early in their lifespan. So, and yeah, I mean, my experience in that time is being in good hands with the people, and like Dr. Kaur and Dr. Eager, and we were really got that support, the team which needed to build that care for my child, that enabled us to have that constant monitoring in place and have a look at what's happening at every stage of his lifespan. And so far, it's going great. We're looking at we are in a kind of a monitoring stage right now, with my son.